What's going on, team? Dr. Andrew Fix back for another episode here on the Code. Really appreciate you tuning in to listen to this conversation with my new friend, Dr. Mona Fahoum. She is a naturopathic physician, primary care physician at a practice called Meridian Medicine in the Seattle area. They have a few locations there. And we got into a conversation on this episode about all things women's health, hormones. We talked about the differences between traditional medicine versus the functional or more naturopathic style of medicine, and how we approach things from either a preventive care standpoint or optimization standpoint, rather than just simply treating issues that are present or treating the symptoms. We really highlighted women's health in this episode, that middle-aged period of time, premenopause, perimenopause, and the hormone changes, the roller coaster of hormone changes that happen in a woman's life when we reach that menopause time frame. We really discussed the importance of starting this conversation sooner with your provider, and not waiting until you're starting to feel some negative effects of those hormone changes, but really talking about how you can start to approach this and how you can address this when the time comes so that you're prepared for it and not behind the eight ball. We discussed the average age of when menopause happens, but specifically how that journey is unique to each person, right? We talk about the average age, but it's going to hit differently for each individual woman. We did discuss the three-legged stool that Dr. Mona calls nutrition, exercise, and hormone optimization, to help you continue to feel your best as you age and you reach that time frame. When it comes to hormone replacement therapy, or HRT, we talked about the differences between bioidentical hormones versus synthetic made hormones, and how many of those on the market today are the bioidentical variety. And then we talked about some of the risks and benefits of utilizing HRT, in order to optimize things from a hormone perspective. Why would you consider doing it? Why might you not consider doing it? And that's a decision that everyone needs to make on their own. So, if this is relevant to you or someone that you know, I hope you really take a lot of useful tidbits out of this conversation with Dr. Mona Fahoum, and we'll catch you guys on the next episode of The Code. See ya. Dr. Mona Fahoum, thanks again for joining me here on The Code. How are you doing this morning?
I am doing fabulous. Thank you.
Absolutely. Well, we were just chatting off air a little bit about, one, some of the tech challenges that we're navigating through this morning. Two, some of the differences between being a naturopathic provider in Washington State compared to here in Colorado or other places. Before we dive into that, could you just give us a little bit more of a background about you and your practice? And then let's get into some of those differences, practicing from place to place.
Sure. Well, first, thanks for having me. I'm very excited about this topic in women's health. That's what my specialty is. So I've been practicing now over 20 years as a naturopathic physician in Washington State. And like you said, that can mean a little bit different things in different places. But in Washington State, I am on insurance. I'm a primary care physician. So I'm doing people's annual exams, PAPs, IUD replacements,
Hmm.
hormone replacement, all of those things, but with my natural medicine kind of lens and perspective. So we do a lot of nutrition and supplements and herbal medicine and all of those pieces, and then pharmaceuticals when we need to, and kind of the conventional things are all kind of peppered in the practice. So I
Got
love
it.
doing my primary care work and women's health as my patients have aged up with me. It's gotten into more and more of a perimenopause and menopause kind of practice.
Yeah, totally. Well, maybe speak to that just a minute. I think this is something that I've noticed in my practice too, is I think I've been practicing as a physical therapist now for a little over 10 years. And the longer that I'm practicing, the more I start to notice that my uh, caseload of clients that I work with is starting to look more and more like me. Now that I'm a dad, I have two kids. That's who a lot of our clients are. And you just said like your clients are kind of like following that same life trajectory that you are. How do you think that impacts, kind of your ability to relate with them and care for them, in a good way?
Yeah, I mean, it was always interesting, and that's why I go by, Dr. Fahoum, but more often I go by Dr. Mona.
Yeah.
And that all came about when I was, 28 and started practicing. And I'm like, God, I'm younger than all my patients. It seems really weird for me to have this personal connection because as a naturopath, we're doing longer visits. I'm talking to them for a long time and getting to know them. and in that integrative care kind of model. And it felt really weird to have them like defer to me in my last name. So that's where I went to Dr. Mona. And now all my patients know me by that. But I'm now older than a lot of my patients, or at least like that same age. And
Yeah.
it definitely, while we can always provide good care, whatever age we are, because it's a skill set that we have, definitely that empathy and that understanding of what they're
Hmm.
going through. All
Yep.
my other fellow Gen X women, like I know firsthand, and it does add a whole nother level of like, wow, the 40s are rough,
Yeah.
for men and for women. We got elderly parents, younger kids, running a business, seeing patients, like it's truly a sandwich. And so
Hmm.
the level of empathy and helping people problem solve and connecting with them has just like grown leaps and bounds.
Yeah. Yeah. I'm 100% on board with everything you're saying there. It's a big deal. And I was having a similar conversation with another one of our providers here at Physio Room. We have, at the moment, as of recording this, we have two pelvic health providers on our team, and currently one has kids and one does not. And sometimes that, depending on the client that you're working with, if that is a currently pregnant, postpartum mom, someone dealing with some challenges, that ability to relate and knowing what childbirth process is like and knowing what parenting is like, it goes a long way into establishing that rapport with
Yeah,
the person. And I think, having worked in the more traditional side of the industry where it's higher volume, you don't have as long of time with clients, and now working in a practice that's more similar to yours where appointment times are longer, I feel like it's more important that to make sure you're establishing those strong relationships with the clients because you have the time to do it and you
absolutely.
don't need to fill that time with just more and more medical stuff, right? More
Yeah.
and more treatment. It needs to be filled with more and more relationship building.
Exactly. It needs to be quality, especially when we're talking about making lifestyle changes and nutrition changes, and we're talking about food relationship issues or personal sexual health relationships. That
Yeah.
rapport is extremely important, and that can happen with, obviously age is not always the deciding factor there, or experience, but even within our own practice, between my two locations here in Washington, there's 9 of us, I think now, as practicing docs, and not every patient, my personality doesn't work for everybody. And so we will refer within the office too, because when we're talking about these very personal things, personal experiences, they may need a different approach. They may need a different person. And we have to set our egos aside and say, where's the best therapeutic relationship for this patient? And
Hmm.
so I have patients come to me from my colleagues and vice versa if someone else is going to be a better fit and we're going to help them move forward in their health.
Yeah, totally. That's exactly what we try to do at Physio Room. If someone calls, it's like who's the person on the team that they're the best fit for so that they can get the top-notch care, but also really connect well with that human being that they're working with. So I was just looking at this on your guys' site. It looks like, just to give people sort of context on the map here, it looks like you guys have those two offices basically on the north side of Seattle and then one a little bit farther north in the northern suburbs of Seattle. An area that I've been a few times. Is that where you grew up too?
I grew up in Olympia, so about an hour south of Seattle.
Got it.
And I always planned on leaving, but Bastyr University, the best naturopathic medical school, is here in Washington.
Hmm.
And I went to University of Washington, and it just happened so that I never could leave. I've got snowboarding an hour away in the mountains and the
Yeah.
Cascades, so I traveled all over. But yeah, I am kind of not born, but raised here in Washington.
Got it. Got it. Got it. Yeah. When you have all those things at easy access, it's hard to justify going anywhere else.
Yeah. Although
Kind of.
I've ridden at Vail and Breckenridge, and they are amazing.
Yeah. Yeah. Definitely. We moved out here from the Midwest, my wife and I, two different places where we grew up, but we've been here for 5.5 years. We're loving it out here in the Denver area, and yeah, trying to make the most of all the activities that we have easy access to. Let me ask you a question that might be kind of hard to give like a very short answer to, but something you said just makes me want to ask this like somewhat obvious question. You practice as a naturopathic physician, and in the state that you're operating, you get to do that in a similar way as the more traditional physician does. Like this
Mhm.
is your version of primary care. It's in network with insurance and whatnot, but that is not the norm. Why is all primary care medicine not functioning in the exact way that you're practicing?
I bet a lot of primary care docs would love to practice in this way.
Mhm.
It's just not how the larger system can operate, right? High volume, got to move it quickly. And, it unfortunately, I think a lot of docs get stuck in the mode of 8-minute visit because that's all they have time for. And that's the
Mhm.
only way they're going to make a buck. I mean, we kind of joke around here that we have to augment our primary care habit. Like we love our primary care, but we're on the insurance model. And that does mean that if we actually wanted to, make a really good living, we'd have 8-minute visits
Yeah.
because insurance is only pays so much for any given code. So we do have things, and as a naturopath and doing preventive medicine and longevity medicine and those kinds of things, we have our insurance visits and our primary care stuff. And then we have some things that are not covered by insurance.
Hmm.
And those non-covered services definitely help pay the bills in the practice so that we can do those longer visits. So
Yeah.
it's definitely a trade-off and it has to be, you have to love it.
Yeah. Yeah, absolutely. I think particularly the people that are listening to this type of a podcast, many of them being our clients, I think they are definitely starting to understand. Many people in the public are starting to understand that sometimes you do have to go outside the bounds of the traditional health insurance network to make sure you're getting the care that you really need for the various things. I've had a couple people say quotes like, "Do you want to be healthy or do you want to use your insurance? Like, do you want to see this particular provider do this particular approach or do you want to use your insurance?" And it cannot
Yeah.
always be both of those things. And that's currently the world with the system that we're living in. What I'd like you to maybe do, just kind of for a high level,
Mhm.
is maybe explain what some of those differences are for people. You've mentioned longevity medicine and preventative care, but generally speaking, what is the difference when someone goes and works with a naturopath compared to their more traditional primary care office? And
Mhm.
then where we should take this conversation, I think, is what are the differences that start to happen, particularly in females, as they start to age? They go from 20 to 30, 40. Maybe there's childbearing in there. Like maybe there's one, two, three kids that this person has had. And then now they're starting to hit that mid-age menopause type of range. And let's go down the path talking about what some of the differences are that they should expect to experience and how we can approach those from a medical standpoint. But from a naturopath compared to traditional primary care, what are the main differences that people would
Yeah.
would expect?
I think you alluded to it in that, conventional medicine and how insurances work is not wellness, right? It's if this is zero, it's when you are ill, it's there to get you back to zero with
Hmm.
a little bit of here's your annual exam, here's your pap smear, here's a little bit of preventive care. That's what they're going to call preventive care. The rest of us in functional medicine, integrative, naturopathic, whatever term you want to put on it, we're going from that zero mark and we're going to work above the curve. We want to live in wellness and optimal care. And so that's where insurance cares less and less about it because that's just not their model. It's not how they operate.
Yeah.
I love, someone comes in with a urinary tract infection, someone comes in with whatever. I'm going to get them to that zero and the baseline. But then, okay, how do we help you excel? And that's where prevention, longevity, whatever terms again that you want to throw in there,
Hmm.
that's where we like to operate. And the difference is going to be, with all due respect, because certainly some of my medical doctor colleagues can do a lot more procedures and other things, and you don't want me doing surgery on you as a naturopath by
Sure,
any
sure, sure.
by any definition, right? They have what they excel at. And then we, as naturopathic doctors, if you're going to a doc who's gone through a 4-year licensed board certified program, because there's a big difference out there too. There's people who call themselves naturopaths who only did some certificate online. And then there's those of us who went to a undergrad for 4 years, medical school for 4 years, and a naturopathic school, took board exams, have a license. So you
Yeah.
really, consumers need to be aware and look at those bios and understand the differences there. That aside, I got trained in the pharmaceuticals and in the diagnosis and in the labs that any conventional medical doctor or DO did,
Hmm.
and the nutrition and
Right.
the integrative thought process around how all the systems connect to each other. You're not just your GI symptom, you're not just your hot flash. How does that whole system work together and doing
Hmm.
that whole person medicine? So the nutrition, the botanical or herbal medicine, supplements, along with the pharmaceuticals, we get to mix it all together. So I
Yeah.
just like to say my toolbox is a little bigger.
Yeah, totally. And I think that's so important because we see the same thing in, like you just alluded to with certificates compared to licenses and whatnot. And in what we do, we operate obviously in the physical therapy side of things, but we overlap and integrate highly with massage therapists, with personal
Mhm.
trainers, with coaches, and this and that. And with some of these professions and some of these careers, the barrier to entry is very low. The ceiling of the caliber of provider could be extremely high, but you just have to really do your research and know like who are you getting, who are you working with, and did they just do a quick online certification to become a personal trainer, or are they a very well seasoned coach? Compared
Exactly.
to, all of us that are physical therapists, it's kind of the same thing. You obviously have to get licensed, you have to
Mhm.
pass all the tests and everything, but some physical therapists are better suited to work with one subset of clients, and others are better suited to work with another type of client. And any clinic or any person can throw, say, sports medicine up on the wall and say we're a sports medicine
Yeah.
clinic,
But
but
how much experience do they have in that
totally,
field? And that's where I
yep,
think you really, as consumers, my patients, myself, everybody, you need to go out to those websites. You kind of have to look like what does their bio say? Like
hmm,
where's that training come in? And then I always kind of joke because I do some teaching at the university, having a laundry list of every condition that you specialize in, that should be a warning. Like no one can be that good at
hmm,
everything.
yeah,
And there's many things I can do, but these are the things, like these 4 or 5 things, this is where I focus. And yeah, sure, I
hmm,
can deal with the cold, I can deal with the, acute things that walk in. But when it gets down into the nuts and bolts of it, I want hormones, I want PMS, I want, all that kind of stuff is where I excel. And then I refer to colleagues. Someone needs, any practitioner, if it's not your field, you got to be open to like, you know what, I'm not so good at that. Let me send you to someone who's an expert in that. And
yeah,
and we don't need turf wars over that kind of thing.
100%. Couldn't agree with you more on that. Now, just to kind of like recap some of what you said there is, and I like this kind of analogy. Traditional medicine is pretty much for that like baseline and under, like normal health and illness end of the spectrum, getting you back to being normal, but
Hmm.
not necessarily for tapping into the optimization and the wellness side of things. There's maybe some, preventative tests and measures to see if you have something going wrong, but not really to see how we can make things better if they're not already worse. Compared to the functional medicine, the naturopathic medicine side of things is can do that illness side of the spectrum, but where it really excels is the baseline and up the wellness side of things, and which I think is nowadays where many people are wanting to spend their time. They're wanting they don't necessarily feel bad, but they want to know if better is out there. They want to know if things are functioning properly and optimally, not just getting by.
Exactly.
Kind of like we might do with our vehicle. Can it get
Hmm.
you from A to B? Sure, but is it running efficiently? Is the gas mileage, high? Is it safe, or is it just getting you there?
Yeah.
Um,
And we're living longer than ever. So
mhm.
is a great segue into talking about women's health care. I often am talking to my gals like our average lifespan from 100 years ago till now is 30 years more. Average
Yeah,
age of death 100 years ago for women was 52. Even worse if you were an African American or Black woman. Now it's 80 for Caucasians, 75 for African Americans. And so we are going to live a long time.
yep,
And we don't want chronic disease. We don't want that slow decline with arthritis and high blood pressure and high cholesterol and diabetes. So
yeah,
we have to shift that focus into how are we going to live well at these older years post menopause, because we're probably going to spend 40% of our lives in post menopause now.
yeah, yeah. I think that's a key point because most of the people listening to this show, most everyone that I know, doesn't just want to live long. They want to
Live
live
well.
and be active and live well for a long time.
Mhm.
Um, and we want those two things: your health span and your lifespan to be as close together as possible, not just hanging on for the last period of your life. So let's talk about that for a minute. At Physio Room, and I just think in medicine in general, I'm pretty sure the statistics show that women seek out healthcare more than men do. And that is definitely the case in our office. We have more female clients than we have male clients. One of the heavy categories of our practice where it is much more female heavy is the pelvic health side of things at Physio Room. Of course, we do work with men too, but females are the ones that are the majority of that schedule. And many of them are coming in in the pregnancy and postpartum and or mid-age time of life where they're dealing with hormone changes, they're dealing with symptoms that could be anxiety, depression, that could be physical challenges that they're dealing with, incontinence related things or pain. Let's talk about some of the major changes that happen as a female hits that menopause age compared to being younger. What are some of the things that are like the key highlights that they're going to experience that we need to be aware of? And then let's then turn that into talking about how we can manage and
All
help
that
with
stuff.
these things. Yeah.
Right. Yeah, I think thinking about kind of our lives in kind of decades, right? We end up in our teen years somewhere getting our cycles, and there's a bunch of stuff that people are, easy, not easy is the wrong word, but helping support PMS, helping support regular cycles. Our hormones are a symphony, right? And everything needs to be in tune and everything needs to be working together. And so nutrition, water, herbal medicine, all those things can help support that. We get into our 20s and 30s where contraception may be the primary thing we need to think about, and fertility on the flip side of that if we are trying to get pregnant. So there's all these terrain issues and hormone balancing kinds of issues that we're working with and working around.
Hmm.
And I love it when my younger gals, they're now familiar with and they've heard this concept of perimenopause, and my 30 somethings are asking about it.
Mm.
Not that they are perimenopausal. I have a soapbox about calling us perimenopausal too early, but in our 20s, in our 30s, thinking about our hormonal wellness and our hormonal health and how are those cycles regulating and how are we taking care of our bodies can very much set the stage for how smooth that transition in perimenopause is. We know PTSD makes perimenopause and menopause worse. We know smoking, oh my gosh, that will bring on menopause early and it will make it 10 times worse.
Mm.
Uh, there's all these conditions that we start with earlier in life that can really have big impacts later as we get a little bit older.
Hmm.
So late 30s, early 40s, that my soapbox is I kind of hate that we're calling everyone perimenopausal simply because they turned 40. I don't agree. I think there are hormone shifts that change. I
Mm.
think things in our bodies are always changing and shifting and adjusting. But in my mind, we should be having pretty regular cycles until our late 40s. And yes, sure, our energy falls off because our testosterone falls a little bit. And we have a lot of, we can have fatigue issues. There can be a little phase of some hot flashes in the early 40s. But by and large, things should be working. And
Yeah.
yes, genetically, some people are going to go into menopause in their early 40s and it's going to be earlier. But on average, we shouldn't be seeing those irregular cycles and the major symptoms hit until 48. Average age of menopause, actually losing the period, is 51. So we
Okay.
should have people on either side of that curve, right? I have some patients who still have their period at 55. They're annoyed because we're
Yeah.
over it by then. However, good job ovaries, right? The longer our ovaries are making estrogen, making progesterone, and doing their job, the better our bone health, the better our brain health, the better our metabolisms. All of those things are working.
Yeah.
And so I am a fan of let's keep things working and optimally well as long as we can, right?
Sure.
Because genetics and life is going to hit at some point. But in that transition, be somewhere in the 40s into early 50s, there's going to be imbalance because that's what the body does. The ovaries start going on vacation, right? They start misfiring. And this month they decided to work normally. Next month they missed. And that's where a lot of women start seeing the irregular cycles, either long or short cycles. Um, some of the sleep dysregulation that can happen because hormones are kind of fluctuating a lot more. Instead of just doing their normal rolling hills, we're getting a little bit more roller coaster like
Yeah.
with those hormone levels. And that's what's going to cause the night sweats and the hot flashes and the mood stuff and anxiety and depression and joint aches and frozen shoulder. Like we have all of these things that can start coming up as hormone levels are changing in the body. Estrogen primarily is the fluctuating one that can cause the problem. But I think a lot of women aren't aware that their testosterone levels from their late 30s on are also already falling. And that can be a big part of the puzzle too.
Mm. Something that you said, obviously, I think all that makes great sense. It might feel very confusing to understand to some people, but one of the things that you just said, just like struck a memory with me of like this is kind of where this conversation was born from. Is I was talking with a colleague and with a client about her frozen shoulder, and this particular individual, this client, she was in an automobile accident before she got sent to a chiropractic office, wasn't making much progress, and then she found her way to our office. And we started approaching her frozen shoulder very differently. But of course, she had the auto accident. She was dealing with much more cervical symptoms and then developed this frozen shoulder. So I think there could have been some of that was, you know, brought on mechanically. But
Exactly.
but I think just as much, if not more of that was probably brought on by she's one of these type of people that we're talking about. She's going through this age period, these hormone shifts. Can you help us understand like how does it happen or why does it happen that we're having these hormone fluctuations, the roller coastering that you mentioned? How does that lend itself to making you more predisposed to something like frozen shoulder or
Mhm.
like achy joints and joint pain and whatnot? How do those two things kind of like mesh up?
Yeah. So our hormones, they are helping us with our fertility, right? That's what we all think about them for, right? Menstrual cycle, fertility, that's what they're there for. But estrogen and testosterone, I'm going to pick on them first because they're kind of the biggest players. But estrogen and testosterone both also support the immune system. They support energy production in the cell. They support tissue recovery. They support collagen production. They're anti-inflammatory in the system. I mean, too much of anything, yes, can be pro-inflammatory. So there's always this like Goldilocks a mat thing with hormones. But generally speaking, if things are balanced and things are in harmony like they're supposed to be, we should have this lovely dance with the immune system, inflammatory markers, all these kinds of things. And I always use the thought that because people see their face as our estrogen and our testosterone falls, we start seeing the sag, right? I got some
Hmm.
too. You get the fine lines and wrinkles. We see that collagen breakdown on our faces, but that same process is happening inside, right?
Hmm.
So the joints, ligaments, and tendons, the bone structure, everyone thinks about it as this hard structure, but it's actually a living tissue and constantly remodeling and
Hmm.
full of collagen and all sorts of other materials. Our blood vessels have connective tissue in them. So as our hormone levels fall, they don't get as stretchy either. So we see this creep of blood pressure in perimenopause and menopause. Everything you see it on your face and in your skin,
Hmm.
but that process is internal as well. And so that's what I'm usually trying to get my patients to really focus on is we need to make sure all the structures internally.
Yeah.
Yes, and we get the aesthetic stuff too. Awesome. But it's really the internal structures that I am most concerned with.
Yeah. I think, of course, in the field that I operate, I think this is so important what you're talking about because the majority of people that we see in our office are going through these types of hormone changes, male or female, right? I know
Mhm.
we're talking a lot
So,
about women's health, but the tendinous, joint related aches and pains that people deal with, how you need to approach those from a rehab standpoint, how you need to train and help those things from a preventative standpoint. It really needs to be like first and foremost at the front of everybody's mind when it comes to like keeping themselves fit and healthy because the 50, 60-year-old is not going to one, respond, two, recover, and three, rehab from potential injuries the same as the 18, 25, 30,
absolutely.
33-year-old,
Oh
something
yeah.
like that.
Don't we
Those
all know that?
tissues, yeah, they just don't have the resiliency. They can't bounce back. And you're helping us understand why that is, not just that it is a thing, but why does that happen and how can we know that so that we can start to put pieces in place to try and minimize that as much as possible?
Yeah, and on that front, it's not all hormones either. I love to say there's kind of a three-legged stool, and you got to have all of it, the nutrition, and
Hmm.
then the exercise, and then hormone balance, right?
Yeah.
All of I hate balance actually, optimization. Um, because we are always in balance, out of balance. That's what the body does, is do the constant dance. But hormone optimization has to be a piece of it. But if you don't have the hydration, right, your tissues are not going to work well if they're not hydrated. Ligaments are not going to be stretchy if there's no hydration and fluid there. Joint spaces are not going to have fluid. You're not detoxing and moving things through the body. And then that nutrition side of things too, with the hydration, if your gut biome, we like to forget that the gut bugs and our gut is kind of everything else in naturopathic medicine. Like we're rooted in gut health. If the gut isn't
Hmm.
working, nothing is going to be working all that well. And
Yeah.
so, terrain of the body, what are you eating? What are you bringing into the system? Are you bringing in lots of colorful fruits and vegetables that are all antioxidant and anti-inflammatory?
Yeah.
And fiber to help bind things and pull it out of the system? Are you feeding your good gut bugs because they help with your immune system, inflammatory markers, and hormone optimization. Those gut bugs are a piece of all that too. So that, and then of course the exercise side. I mean, we are going to get tighter as we get older. We're just less stretchy, but the maintenance becomes so much more important. You got
Yeah,
to, do the yoga, do the stretching. Obviously, that's your field, and
totally.
you're the expert there. But you got to have all those pieces of in the milieu, or it's not going to work.
Yeah, yeah, 100%. I think this conversation is so important. I think the average um understanding, the average level of like how people understand this stuff is gradually going up. Like
Mhm.
back to the exercise thing. I'm seeing more and more people starting to resistance train, starting to, challenge themselves. But the norm is not that, right? It's still a small percentage when we really look at a big sample size. We're gradually moving in the right direction, but I think the more and more times we can have these conversations get out to more and more people, the better off we're all going to be. Um, let's start to talk about the hormones a little bit. We've talked about some of the changes that happen as someone ages, particularly as a woman ages, that, there's a curve, right? There's a curve of like some people are going to hit that menopause at 51. I think you said that was the average
Yeah.
age. Some after that, some before that. And that's how it should be. It's not just when you hit a certain age. That's not the
Yeah, it's
answer.
it's not the end.
Yeah, that's not the end. But so how should we approach this? And I guess back to like the hormone piece, I feel like we're starting to um, see like two sides of the coin here. We have some people that seem like they're fully on the side of the fence where it's like, yes, take peptides, take GLP-1s, do hormone replacement therapy. And then I feel like we have other people, providers and clients, that are like, no, we don't know enough about that stuff yet. You don't
Mhm.
necessarily need that. Um, where do you fall on this sort of side of the conversation, and how should we be approaching this conversation?
I very comfortably live in both sides of the conversation, one foot in either side, because it's
Hmm.
really about the person and the patient in front of me. And
Yeah.
I hope that's true for most providers. I know it isn't, but I'm going to hope that it can become true. That I've got some patients who are fully like, no way, this is natural. It is natural for us to lose our hormones and go through this aging process. Some people live in that land and they're not going to take anything. And that's fine. We can look at botanical medicine. There's herbs that can help with hot flashes. There are phytoestrogens in our nutrition and in the herbal medicine land that can help support estrogen a little more naturally in the body if that's the route they choose to go. And I don't want us to ever berate a patient who does decide that that's right for them for whatever reason. And then I've got patients on the other end of the spectrum who are like, give me the peptides, give me the GLP, give me everything. And that can be appropriate sometimes if they have a high family history of osteoporosis in their family. They
Hmm.
are absolutely candidates. And especially if their periods decide to conk out in their late 40s, they need to be on estrogen. We have
Mm.
got to protect their bone health. And so we've got some people who that is fabulous for. Where I kind of leave that land a little bit is there's some groups I think that are maybe a little further out than I feel comfortable as a provider because we don't have as much data as we probably need to. Now, someone's got to be out on that fringe to help us get the data.
Right.
But I think there's definitely time and place for like this microdosing or low dosing of the GLPs. It can be extremely helpful. They can be anti-inflammatory and do all sorts of great stuff. But if you're not going to optimize the hormones, if you're not going to do the exercise and you're not going to do the nutrition, there's a lot of downsides with those medications.
Yeah, I love that you mentioned that.
Yeah.
Yeah.
I just think you got to use them appropriately, and there are good ways to use them, and then there's some not so good ways to use them.
Hmm.
And most of my patient base probably lives in the middle with me, where we are doing all the natural pieces and we're doing the hormone replacement. We're
Yeah.
treating the gut and doing probiotics and doing all the fiber and all of those terrain pieces. And we're probably initiating some hormone replacement as well, because the data is pretty clear that starting it once periods start, teetering off and stopping, adding in estrogen to protect bones, lower dementia risk. Testosterone, some people don't agree with testosterone. I think there's quite a bit of research and more research on the pros of using a low dose, female doses of
Hmm.
testosterone replacement as well. And then progesterone if they have a uterus and all those other pieces. We're probably doing a lot of prevention and really keeping people's health optimized. And in my mind, that's doing, even though it's taking something, and I have this daily conversation with patients, especially as a naturopath, they don't want to take anything, right? Taking a medication. I'm like, we have to shift that thinking a little bit because we're going to live 40% of our lives in menopause. I would rather take a few hormones to replace back to a normal level,
Hmm.
take those so I am preventing the blood sugar, the cholesterol, the hypertension, and the meds that I may have to take in the future if I don't maintain and optimize my health now.
Hmm. Yeah, I think that's a really good way to sort of change the mindset and change the viewpoint of how we look at these things because I think I fall in that same category too. I want to take as little synthetic
Little.
stuff as possible and do stuff as naturally as possible, but there is a time and a place for all these things. And
And there's also separation. The hormones I'm always talking about are bioidentical and
yeah,
natural, but it's
right.
still taking something. It's still an
Sure.
exogenous hormone. But yeah, I'm definitely not a fan of the synthetic hormones.
Now you mentioned the if someone is doing hormone replacement, the term bioidentical. Help us understand the difference, Mona, between bioidentical hormone replacement compared to other options out there, something that's, synthetic or something like that. What does that mean?
Yeah. So there's multiple different ways to think. I mean, these are all molecules, right? And we've got chemicals or molecules that look exactly like what our ovaries or in men, the testes produce, right?
Hmm.
Testosterone and estradiol, and they convert to different kinds of molecules in the system. When we're looking at replacing them from the outside, you've got synthetic and you've got bioidentical. Synthetic means it looks pretty much like what our bodies produce, but not quite, and it's made in the lab and it's synthesized, which can be really good. Something like, for example, like birth control. You can't use estrogen that we make
Mm,
as a birth control. It's ineffective. You can't get the same levels, whatever. So like or birth control pills or a progestin IUD, those are synthetic hormones with a long track record of safety that suppress ovulation. And that would be a type of hormone replacement,
mm, hmm.
birth control. That's a synthetic not ages ago. Well, I guess it's getting to be ages ago because I'm getting older and older. Premarin, a lot of women are familiar, have heard of it before. Premarin, and it still exists, and Provera, those are synthetic hormones that are have been historically used for hormone replacement.
Got it.
They kind of look like our estrogen, but they're kind of not. And when we look at the data that both the WHI study that came out in the year 2000 and what scared everyone away from hormone replacement, they were using synthetic hormones. They're kind of like what our body produces, but not exactly.
Mm,
And when we look at research between the synthetics and bioidenticals, those that match what our bodies make, the data is very different.
yeah.
The safety profiles, the side effects, the risk factors are different between synthetic and bioidentical. So bioidentical means that they are the same molecule that our bodies are able to produce on their own. And so that makes sense, right? They're going to fit into the receptor the same way. They're going to act the same way as our ovarian hormones or testicular hormones for men. Um, and that also doesn't mean that you can't get it from a pharmaceutical company. So I run into patients who think that because I put them on an estrogen patch, it's not natural. Well,
Mm,
no, it turns out estrogen patches, oral estrogen, it can be synthetic, but they can be bioidentical and then covered by insurance and a copay and cheap and affordable and accessible for most people.
mm,
And then we can also get them in compounded as well, in creams, in pellets, in other formats. But when we're looking at bioidentical hormones, we're looking at they are made in the lab. However, they're coming from wild yam in nature, makes a compound that in a lab we can convert into testosterone, into estrogen, into progesterone. And so they're plant-based hormones that happen to be used in a pharmaceutical setting.
hmm.
Not to mean that you can take wild yam and it does the same thing. Our
Yeah.
body is incapable of doing that conversion. It's something they do in the lab. Um, but yeah, so they're plant-based hormones that happen to be in a patch.
Yeah, that's so interesting. How can looking at this from like a client or a patient perspective, how can somebody know? So like say somebody's chatting with their provider, the topic of hormone replacement comes up,
Mhm.
and now hearing this conversation, they're like, "Well, I want the bioidentical ones that are going to function the same way as, the ones our body produces." How do they know or how do they make sure that that's what they end up getting?
I would say by and large, many providers, most providers, conventional or otherwise, have mostly moved to the more bioidentical,
Awesome.
even if they don't realize they have, right? Because very few docs are prescribing the Provera, Progestins, Premarin kind of formulations anymore. They're using the Dottie patch, the Ilani patch, or the Lilani patch, all of those, and those happen to be bioidentical. So
Hmm.
if it's estradiol, what you're looking for is the name of the compound, and telling your doc you want the more natural, not the synthetic. They'll probably going to know that information.
Yep.
If it's estradiol, it's or estriol, it's going to be bioidentical.
Got it.
If it says norethindrone, if it says ethinyl estradiol, if it has those more chemically looking names,
Yep.
it's probably a synthetic.
Yeah. Yeah, I like that. And it's a, relatively easy explanation. You mentioned that there are maybe like fewer risks to consider when we're talking about the bioidentical ones. But speaking of risks, just because we're taking something, even though it's we're taking something that is naturally producing in our body, we're trying to keep that going for years longer because we're living years longer. What are some other risks, if anything, that people should be mindful of if they're considering hormone replacement therapy?
Absolutely. So, generally speaking, the more and more data that is coming out around bioidentical hormones, the safety profile is pretty good. That said, there are certain people that it may not be the best fit for, and we need to think about other options. Someone with an active breast cancer, typically, we're not going to put on any hormones because the hormones can feed said breast cancer if it's an estrogen receptor or progesterone receptor positive cancer. That said, we, the medical community and research community, have pretty much debunked that hormones cause cancer, right?
Yeah, okay.
Progestins, a synthetic progestin, may slightly increase the risk for breast cancer, but again, a synthetic progestin, we know you can get breast cancer whether you're on hormones or not. So, and if you get breast cancer on hormones, it doesn't mean that hormones caused it, but we're certainly going to take you off of it because the last thing we want to do is put gasoline on a fire, right? And so, certain patient populations, we're not going to go there. There are also some risks, negligible but real, potentially with oral estrogen. That's the one that most people are familiar with like a clot risk or a
Hmm.
gallbladder issue with oral estrogen. And so many women, we will use transdermal, meaning a patch, a cream, something else, because we get rid of the small but possible clot risk with oral. Because oral has to go through the gut, through the liver, and just the whole conversion and absorption process is different than through the skin. And
Yeah.
so women with a history of a blood clot or a DVT or a pulmonary embolus, they are not fully contraindicated from hormone replacement,
Hmm.
but we definitely would never put them on an oral,
Got
right?
it.
So there are some caveats in there, but the only other big risk that I tell gals, and every provider should know this, if they have a uterus, the most important thing is you got to take progesterone with the estrogen.
Hmm.
Because estrogen is what helps thicken the lining, get it ready for pregnancy, right? And it thickens, thickens, which means cells are multiplying. Progesterone is what thins the lining, causes the bleed, right? And keeps everything nice and thin.
Yeah.
Fertilizer mower is how I think about
Yeah. Okay.
it.
Yeah.
And so the only real risk with hormone replacement is if you're taking estrogen unopposed with the progesterone, then you could increase the risk for uterine cancer because that lining is proliferating out of control. And you're
Hmm.
going to have spotting and bleeding. And who wants that after they've already stopped their periods in menopause? So you do have to pair estrogen and progesterone together if you have a uterus.
Yeah, I think that was awesome. That kind of explanation. I like the analogy that you used. But just some things to be mindful of, right? If you're considering this, you and your provider have made the decision that this makes sense for you. Here are these factors that you should also be considering. What about if somebody, you mentioned if somebody has an active breast cancer, what about if they have previously had breast cancer, but now they've been considered cleared and in remission from all of that? Same thing?
That's when you got to find a doc who knows their menopause management,
Yeah.
and it's going to really depend on provider comfort level, right? And unfortunately, myself included, in naturopathic school I got a fair amount on hormones and some on menopause, but not that much. Most of my
Yeah.
education has come post grad on my own, continuing ed,
Yeah.
and medical docs often only get like half an hour or like one class on menopause. It's a we weren't trained in it.
Yep.
And so unless your provider's gone and gotten additional training or some certification in menopause from the Menopause Society or something like that, some docs are going to be very uncomfortable about giving some women hormones, and other providers are going to be like, yeah, sure, let's do this. Let's talk about the risks. Let's talk about regular surveillance. I mean, all my gals, they don't get hormone replacement unless I'm getting my mammograms every year,
Yeah.
right? Because even though the hormones are not the problem, there's still a 1 in 8 chance they're going to get breast cancer, because that's just our walking around every gal's risk, right?
Mm.
And so we still got to make sure, because I don't want them on hormones if a breast cancer were to develop, right?
Yep.
But personally, I feel comfortable with some people. You have to, weigh all the risk factors, starting hormone replacement potentially after a more serious condition.
Yeah.
But not everyone is that going to be a good fit. And not
Sure.
every provider is going to feel comfortable with that.
Yeah. Yeah. That makes sense. Thanks for kind of walking us down that path. What about, one of the other things that was sort of striking interest to talk about is you've mentioned a couple times estrogen, bone health. What are the ways with clients that you work with that you like to measure bone health? Are you guys using DEXA scans, or how are you going about measuring that and then managing or improving that with clients that you're working with?
Yeah, absolutely. DEXAs are they're the standard. So
Yeah.
we often are getting DEXAs. I will occasionally also get urinary or serum NTX, N-telepeptide.
Hmm.
It's considered investigational still, but it is N-telepeptide may give us more information about current bone turnover. Whereas a DEXA is one in time and you can't check it. It's a long-term measure. You can't get another DEXA for at least a year. An N-telepeptide can sometimes tell us how much is actively turning over, and the lower the number, the better.
Hmm.
So I will use those on occasion, especially with my patients who actively have osteopenia or osteoporosis, and we're trying to turn things around. But by and large, it's DEXAs for most people. And then we are, of course, doing all the resistance exercise, weight bearing exercise, all of those pieces, and then nutrition. And there's a few supplements I like to use, obviously D with vitamin K.
Yeah.
That's going to be great. I'm usually using some collagen, like MCHC, and some specialized collagen, and then calcium. But the more we know about bone health, the more we know that calcium is only one little piece of it. It's more about that matrix and the scaffolding that all
Yeah.
those minerals are sticking to. And
Hmm.
then hormone replacement is obviously can be a very big component, because that's one of the things that the FDA has approved us saying is that estrogen can be used as a primary prevention for bone loss.
Okay. Yeah. Which, I mean, it is so huge because I think, I talk to people about this kind of thought process that our world continues to get easier for us from a physical standpoint. We don't
Mhm.
have to take the stairs if we don't want to. There's elevators and escalators. You don't have to pick up and carry things. You can roll your suitcases or your backpacks, or you can push the stroller instead of carrying your child around, or whatever this is. And from a muscular and skeletal standpoint, that's not necessarily a good thing for us, right? It makes us weaker. It makes us a little bit less resilient to managing things when we do have to do them. And then we still, in the physical therapy world, we still battle this conversation where clients will come in and they will tell us that they've been told by a physician to avoid certain things because of arthritis, or like avoid impact exercises because of their knee, or whatnot. And we know that the data just doesn't say that. That's not what it says. It does not say that running's bad for your knees. It does not say that squats shouldn't be done when you have knee arthritis or anything like that. But that's what people still get told. And from a bone health standpoint, we want people to be loading.
Yeah.
We need you to still be loading so that your bones are strong, so that you can tolerate things. And one of the things that like we're thinking about heavily as people are aging is fall risk is going to keep going up. One, we don't want you to fall. But two, if you do fall, we don't want you to become significantly injured due to that fall. We
Exactly.
want you to be able to withstand it, get yourself back up, and not be dealing with some significant injury that could put you in the nursing home or worse in
Mhm.
for the rest of your life. And that might be very short. The statistics on falls are very scary.
Yeah.
So,
And that's
um,
where I'm always encouraging patients, like doing balance exercises, doing so, because even if we're all probably going to get a little bit of bone loss as we get older. And even
mhm,
if you have osteopenia or even osteoporosis, the bone loss is one thing. It's the fall It's the
Hmm.
not knowing how mechanically, do you have core strength? Do you know how to fall? I mean, I'm
Yeah.
like thinking like snowboarding. You don't put your arms out and catch yourself. You break your wrist, right? You got to
Yeah.
learn how to like tuck and roll. And so learning that stuff, having that muscle memory as we get older and the balance in the core is really
Yeah.
important. And also same thing with the arthritis. Like if you're not using it, it's going to get shorter and tighter. And when
Hmm.
ligaments are short and tight, those joint spaces are going to compress even further. And now we have even more friction. Whereas if you get to PT and you're stretching and you're opening things up, you actually may have less arthritic pain
Yeah.
because you're getting better fluid and more flow and more hydration into those joint
Hmm.
spaces. So
Yeah.
yeah, it's hard for patients to get that their mindset there, and it
Yeah.
can be uncomfortable while they're getting there,
Right.
but it can actually be really good in the long haul.
Yeah. Yeah. I'm glad you said that. Just more fuel on the fire in terms of like keeping people active and moving for as long as
Mhm.
possible. You started to mention, I want to hit this before we wrap up here. You started to mention some supplements related to bone loss. What about just like other supplements? We've talked about the importance of making sure we're eating
Mhm.
a diet that is full of variety, that's full of natural foods, anti-inflammatory foods and things. I don't know that we really necessarily touched on it too much, but making sure you're getting enough protein, you're hydrating properly. We talked about that. And then you mentioned vitamin D and K, collagen, calcium from a bone health standpoint. What about just other supplements that people should be considering taking that even if they are eating what appears to be a pretty healthful diet, they still might not be hitting the levels that they could or should of certain things.
Okay. Obviously, I want everything as much as possible coming through food and hydration because supplements should be supplemental, right?
Right.
They should not be, oh my God, 12 pills at a time and then there's no room for a meal, right? So I do like to keep them to a minimum. They're a supplement. However, um, doing a basic multivitamin I think is just cheap health insurance. It's what I call it with my patients, right? Because our food supply is not quite what it used to be. We're of course going to try to eat our fruits and vegetables, but getting a few extra B vitamins, that extra D, whatever, the minerals is going to be helpful. If even if you're getting enough plant food in your diet to feed your gut microbiome, a lot of people could use a little extra fiber because it helps with hormone balance, it helps with cholesterol, blood sugar management, feeding those good gut bugs. So certainly fiber could be useful for some people, and or a probiotic.
Yeah.
And sometimes the combination of the two are going to be helpful. And then I also think about potentially for some women, it may be at least as menopause, it may be a phytoestrogen supplement. I try to do that through food because, like, we got soy, which is a phytoestrogen, you got flax meal, which is a phytoestrogen. So there's things in our food that can help with our hormone balance, but then sometimes we need a little extra. So occasionally I'll pull out the soy isoflavones, or there's some other things that we can augment to help with hormone harmony in the system.
Mhm. Yeah. Yeah. I think I like your approach of like, let's take these things that we may need to supplement, but let's not try to supplement our health. Like
Yeah.
take supplements to make us healthy. Try to get it through the other methods first, and then take the things that you need to help to optimize things as best as
Mhm.
possible. What would your recommendation be for people who they hear this conversation, they don't live near Seattle, they would love to come see you, they're unsure of like what to look for, who to look for in terms of a provider to help them approach their health in this type of a manner.
Yeah, I'd say, I mean, there's obviously there are good influencers out there, you you being one of them. You got to kind of put on your thinking hat and critical thinking. And there are people out there who are great, and you can learn a lot on your own and take that back to your conventional provider if you don't have a naturopath in your area. Because a lot of conventional providers are really starting to tune into this. Nurse practitioners, I think, are a great option. They oftentimes are a little more willing to step outside the box, but I know I have some medical doctor colleagues and DO colleagues who are very open. They've done some functional medicine training. Maybe on their bio, they've attended some Institute of Functional Medicine courses, or, like done or gone to NAMS at the very least, so North American Menopause Society. You're going to want to look for a provider who's done some of that education specifically around menopause and what's going on for our bodies at this age. Um, and so that can be a conventional provider. And then, of course, if there is someone, if there's a licensed naturopath in your area, or there's a functional medicine or integrative medicine doc, they're usually also have done the training to be a little more educated on this front.
Yeah, yeah, I love that. I know there's going to be a lot of people that listen to this that are very interested in checking out those providers, finding somebody that they can connect with, potentially bringing that information back to the person they're already working with, and just taking some steps to help themselves age as gracefully and optimally as possible so that they can continue being as active and feeling good in the process for years and years to come. So I think this conversation was awesome, long overdue, and something that hopefully we get to just keep opening up more and more conversations and talks on. Any last things that you want to make sure we hit that we sort of grazed over or glanced over that would be really important to mention before we close it out?
No, I think this has been fabulous. I think the only thing I like to just leave all my patients with, male, female, whatever, is our bodies are healthy. Their baseline is healthy and they know how to fix themselves. They are
Hmm.
resilient if we give them the right tools.
Yeah.
And there is nothing wrong with us in menopause and in our 40s, right? It is a normal process. It is a natural process. And there's an element out there. And I love that we're all talking about this more, but there's this push to like pathologize it too.
Hmm.
And I don't want any gal thinking that there's something wrong with her. Your hormones are doing what they're supposed to do. Sometimes that can be uncomfortable, and we need to bring those peaks and valleys closer together so the experience of it is better, but we just need to support our natural processes.
Yeah. Yeah. Love that. Love that closing piece. And um, you guys that tune in to listen to us here on the code, please share this conversation with someone else. If you think there's somebody else that can relate to this, that might benefit from hearing this conversation that Dr. Mona and I just had, please share it with them. And if you're liking this podcast, please go leave a review, right? If, whatever platform you're on, scroll to that review section, drop a review on there so we can get more and more of these types of conversations out on the code and help more and more people. Dr. Mona, thank you so much for carving out the time to meet with me today. From everything that I know about you, I know that all the patients that you're working with are in phenomenal hands. And all you guys that tuned in to listen, thank you so much for joining us on the code, and we'll catch you on the next episode. We'll see you later.